Information Risk with David Loshin, powered by InsightJam.
I'm Doug Atkinson at Solutions Review, and welcome to another episode of the Information Risk Podcast with David Loshin, who is the principal analyst at Knowledge Integrity and one of our Solutions Review experts, and has been my co-host for this series. And David, today we've got an interesting topic, semantic interoperability. And this gets into all kinds of interesting definition issues and certainly data issues and compliance issues and so forth. Why don't you break it down a little bit as to why you wanted to talk about this one?
Thanks. And yet again, thank you for doing this. This is a milestone for us. It's our 10th episode, and we continue to grow our audience, which is great. What happened was the other day, I was kind of thinking back on a conversation we had in one of our earlier episodes, which referred to electronic medical records. We were talking about healthcare in general. And one of the problems that electronic medical records has is that the systems were mandated by law probably about 15 years ago in the high-tech law that was kind of a follow-on to HIPAA. And one of the challenges that was posed was all practitioners or healthcare providers were being motivated to move to doing electronic health records and they were being incentivized by getting incentive payments for certain milestones that they were able to hit in their transition towards these EHR systems. I'll use the term EHR for electronic health record, or EMR, electronic medical record. I'm not really I'm not an expert enough to know if there's a difference between them, but I'm going to use those interoperably. It's funny how I slipped it there on our topic, but anyway, these EMR systems were mandated, and so a lot of companies kind of jumped into that market and created electronic medical record systems and sold them or marketed them to a bunch of healthcare providers. As part of the evolution of that industry, also part of the outcomes of some of these legal proceedings and the new laws also motivated the consolidation of healthcare provider organizations. So, if you recall, 20 years ago, you probably went to your doctor, you scheduled a visit by calling the office, and the office was a practice that consisted of maybe 3 or 4 practitioners. The best motivation for the transition towards these new environments led towards this consolidation. So today, when I contact my healthcare provider, he's actually part of a practice that is owned by a healthcare system. So there's a overall environment where the systems are being managed by a much bigger conglomerate, and they're managing all the health records, and they're usually doing it through some kind of EMR system that provides a portal to the patient. So today, when you want to talk to your doctor, you will they won't call you and leave a voice message on your machine other than to call you back, or they'll say, go to the portal, check to see, your lab results are in, go check on the portal. Or if you want to schedule an appointment, go to the portal. Or if you want to request a refill on one of your prescriptions, go to the portal. And basically the portal becomes the channel through which you are communicating with providers who are associated with a provider organization that are giving you healthcare service. So I'm gonna take a breath there for a second just to see if you had any questions about that just as yet.
No, but I know the portals have become, incredibly important, and quite frankly, they're also incredibly convenient because you can go back and take a look at test results or tracking information or whatever billing and appointments you have coming up, particularly if you have more complicated medical issues. So yeah, I get it. I think it's also interesting because I think we're going to get into this. The fact that the world never stops evolving, which means the terminology evolves over time, and what you end up with is, as these things oftentimes, never start out perfectly. They start out organically. Somebody launches a portal, and then everybody wants to launch a portal, or somebody hires a medical records solution provider, and then other systems get a different solution provider, and terminologies are not the same. And then you're trying to get this cross data semantic exchange to work when somebody's using customer, somebody's using client.
So we're going to drill into this, but what I wanted to do first was look at some of the challenges that are created by this transition to, or this kind of ungoverned transition to, all sorts of different electronic medical record systems. And I'll give the example, and I think you and I chatted about this in one of our earlier episodes. We were talking about the healthcare challenges you were working with some of your family members. Is that if I want to talk to one of my healthcare providers, like my primary care physician, I go to that portal. But if I want to go to one of the specialists, they don't have the same portal. They've got their own portal. And so they've got a portal, and every other specialist has their own portal, and they don't necessarily talk to each other. And that's one issue. The other issue is that there's this desire, from I would say one of the root motivations of migrating towards an electronic medical record system is to be able to provide consolidation of all of the information about an individual's health history, so that when they do go to a physician or some kind of healthcare provider, that healthcare provider can get access to a holistic view about that individual as a patient. And we can see kind of echoes of that in the way that, say, Centers for Medicare and Medicaid Services, the way that they are motivating the different kind of healthcare models, where there's coordination of care, meaning that there's one practitioner whose job is to manage the interactions with all the other practitioners. And this only works if you can share information across all these different systems. The problems, there's two main problems here. One is that these systems weren't designed to interact with each other. That's number one. Number two, there's too much reliance on the ability of automated means to consolidate information when they actually are able to share information. And I'm going to give an example here. And again, we're going to give all the links in the notes. I'm reading from an article that was in Information Week, and I believe it was literally 6 days ago, it's called "Electronic Health Record Errors Are a Serious Problem," and I'm using this not to talk about health record errors, but rather the description of the example that the writer gives in the article is a symptom of what happens when systems don't talk to each other. And I'm going to read from the article here. He says, on March 5th, I checked in for my annual physical at Northwestern Medicine's Old Irving Park location in Chicago. Northwestern Medicine is a major healthcare provider in the Chicagoland area. It operates 10 hospitals and some 200 outpatient facilities. So that's, now my parenthetical comment is, that is just an example of what we were just talking about, which is, instead of there being, he was going to go to his primary care physician for an annual checkup, but that healthcare provider is part of a major healthcare provider that operates 10 hospitals and 200 outpatient facilities, including his PCP's, primary care physician's office. The facility where I received care opened on November 1st, 2023. When I walked in, it was nearly vacant, a typically sterile institutional building filled with long stretches of padded furniture, abutting large windows overlooking a scruffy stretch of Irving Park Road, et cetera, et cetera, et cetera. We get to the part where he's actually seeing the physician. He says, when the physician entered, he probed me for additional details more thoroughly than many primary care doctors that I had encountered, which I appreciated. We quickly worked our way through my medications, my ongoing issues, and finally arrived at my surgical history. At one point, one of his questions stopped me short. You had retinal detachment surgery, I recall him asking. How is that doing? Retinal detachment occurs when the retina, the nerve tissue containing the receptors that perceive light and allow our brains to form images, pulls away from the back of the eye. It has never happened to me. However, it did happen to my father, with whom I share a first and last name, in 2017. He underwent surgery to correct it at Wheaton Eye Clinic in the Chicago suburbs and recovered in reasonably short order. The person who interviewed him had inadvertently entered his information into my record. Odd, I thought. I have never visited a Wheaton Eye Clinic location and have never had a serious vision problem that required surgery. I wondered how they might have had access to my electronic health record in the first place. As it turns out, Northwestern Medicine shares a medical record system with Wheaton Eye Clinic. So it goes on to talk about some of those issues. But the point that I want to make here is how there's this fear of getting the wrong information. Now, I think a couple of weeks ago in one of our other episodes, I was joking about how there's very few people who share my name, but they keep getting mixed up with me, and so I get information about their royalty account or their stay at some hotel, and whether I enjoyed, whether I would fill out some form or some kind of survey about how much I enjoyed staying at some hotel that I'd never been to, or et cetera. I mean, and this happens relatively frequently, considering there's 5 people in the country of 330 million people who have the same name. It really is not that common, but apparently it's not uncommon, for people to get me mixed up with those other people, and they probably are getting mixed up with me as well. So if it happens with me, and now we have another example of the author of this article. I'm checking to see if there is a byline there. It's Richard Pallardy. So he shares a name with his father, and the healthcare professionals, were able to get access to the father's health record, and without doing the necessary validation, inadvertently merged information from those 2 records. So this is within the same healthcare network, within the same healthcare medical record system. So if we see that there are issues that are occurring when we are when the same system within the same network is being used, think about the complexity of trying to create a holistic perspective on any individual's composite health record that's being pulled from different systems across different healthcare networks.
So I just had my annual physical, and I think everybody is always puzzled in this day and age when they hand you a clipboard or an iPad and say, fill out all these fields. You're like, well, I've been coming to this doctor for 5 years or whatever it is. But I mean, for me, maybe longer. It's like you have all this. You have all this, unless you want to ask me whether I've been, recently down with COVID. Unless it has something relevant in that regard, you don't need to ask me my allergy history. You don't need to. You shouldn't. It feels to me like you shouldn't have to. And you wonder, are they using that as more of a flinch against whether or not they're getting the right record? It's almost like a chance for you to kind of put your own brakes on whether or not they have the right record. Because I share not only a first and a last name, but a middle name with my father. He's a junior. I'm a third. We shared it both with my grandfather. So I can see how it might happen. I can see how it might happen.
Well, it's easy to happen, and there's an interesting method of trying to address that. But
what is that?
All right. So number one, you're hitting the nail on the head. I'm going to refer back to 2 different things that my company worked on. One was a data quality initiative in Australia that we worked on. It was called the National Electronic Health Transition Authority, NETA, and it was at the time that the Australia was moving towards having a unique healthcare identifier, UHI, and one of the things that we were asked to do was to assemble a data quality strategy for ensuring the quality of information associated with linking information using that unique electronic identifier. And that was what was interesting about that is, our client was this authority, was a temporary government organization whose job was to facilitate the transition towards these electronic health records. And they had some degree of authority with respect to making recommendations to the government about how to mandate the actual laws relating to electronic health records. And I'm really proud to say that our data quality strategy was actually integrated into their law, that about all the rules or all the recommendations that we had made about maintaining data quality for use of electronic health records was actually codified in Australian law. So that was actually kind of an interesting experience. And yet in the United States, there is no unified or uniform health identifier. However, a couple of years ago, the Department of Health and Human Services, they had an initiative. It was a kind of not a seminar. It was a bunch of meetings to discuss the feasibility of introducing a unified healthcare identifier. We were participating as one of the invited speakers to talk about a unique identifiability and aspects of data management associated with what we call master data management that would be necessary in order to ensure that, again, that uniform health or not uniform, unique healthcare identifier would actually do what it's supposed to do. But if everybody had a unique identifier the same way everybody has a social security number, then it would be much easier to be able to ensure that your record and your father's record and your grandfather's record don't get
and everybody
stuck.
has. Ultimately, isn't that what the health insurance card is effectively? Is a unique health? Maybe it's not across system, but
it's not, because it's not across systems. You're
So what would be the argument against implementing this? What is the argument against implementing?
So I think part of the argument against implementing that is a question of privacy. I mean, I think there's been a large degree of abuse of social security numbers because, look, I remember when I was in college, my social security number was my college ID. And when it came to, at the end of the semester, we wanted to find out what our grades were. The professor posted a list of the grades on his door, which was the student ID number, which is your social security number, and your grade. Well, I mean, today that's absurd. Nobody would put a social security number, or let alone a list of social security numbers, on a piece of paper, that are being taped to a door.
There was just a massive hack of AT&T. It's outrageous the amount of times that your social security number has been hacked. I mean, it's quaint to think that a vulnerability would be a printed social security number on a piece of paper and the political science department of some university. It's like
yeah, right. But I mean, again, like it wasn't as prevalent back then because this technology didn't make it easy to exploit that. But I think that's always been the aversion in this country to have any kind of unique identifier is because of privacy concerns. But
the hell of it is that there's at this point, I mean, it's a complete red herring. That there's more to it than that. That it's a left, right, blue, red control thing.
Yeah, I don't know, but it was good that the government was actually taking up the challenge and looking to see what the ramifications would be of trying to move towards that. So I haven't looked in on that recently. Maybe we'll do a cycle back on that particular topic. But red herring wise, I'm just using this as a motivation to talk about something different than unique identifiers. I really want to talk about the question of merging information or composing information from different systems. And the healthcare environment is a good starting point, but in fact, it's not limited to the healthcare industry. Every industry, to be able to do more efficient and optimized operations, has to share data across domains where it wasn't engineered in the first place to be able to merge the data together.
Yeah, good. So why don't we take a break right there? And when we come back, we'll get into the main topic of semantic interoperability.
Solutions Review is inviting you to join InsightJam.com. What started a few years ago as a social media event to celebrate enterprise technology has now grown into an always-on tech community with live events, discussions, videos, vendor showcases, and industry resources. Our vetted roster of experts, thought leaders, and analysts are sharing tips and tricks daily. So if you're interested in getting involved, join the long list of companies and brands who have already participated by visiting InsightJam.com today. Now back to the show.
All right, we are back. David, we're going to get into the inevitable issues that happen with regard to misinterpretation around natural language. So many of these systems are dealing with natural language notes and other bits of information, not just kind of the codes that can be universalized around tests or results or things like that, but this more ambiguous, squishy kind of textural data that exists across systems.
Yeah. So I started thinking about this when I had some conversations with two different sets of people. One was a company that was explaining to me how clinical trials are populated. It has to do with finding a population of patients who have a particular set of criteria that would be good candidates for some kind of drug trial. And to do that, they need to look at healthcare records. And typically, these are going to be environments where all the personal information is masked, except for all the information about their diagnoses and the notes associated with their histories. And so it's one thing to do this manually and having to plow through dozens, if not hundreds, of records looking for a population of candidate patients for a particular trial. And that's pretty much how that's done. And this costs a huge amount of money because it's not like you could hand this off to high school students in China to do. This is the kind of thing where you need some level of expertise to be able to read through a health record, which may consist of dozens of notes over years that would give you the ability to determine whether an individual is a good candidate or not a good candidate. So it's a combination of looking at structured and unstructured data. And so solutions that involve some kind of automated means to do this, namely some kind of language processing or large language model that can learn from huge amounts of records and be able to accumulate some kind of knowledge environment that would be able to answer a question: is a particular candidate or a particular patient a good candidate for a particular clinical trial? And then, coincidentally, my son is working as a research assistant for a hospital organization where he's doing that same thing, and he's tinkering with writing code to make use of some kind of system that can be used to help identify and manage candidates for clinical trials. And so I saw that as being, it was kind of coincidental that those two things, but it's one of these things where you never think about it until it kind of pops up multiple times, and then you realize how frequently it's actually a problem. And so I started looking into this a little bit, and this is where I came up with this whole question about semantic interoperability, which is I'll give I'll trigger this with an example, from another healthcare environment where one healthcare practitioner is reading the notes left by other healthcare practitioners, and I'm going to quote from a published paper from AHRQ, the Agency for Healthcare Research and Quality, and it refers to a case where the patient with an alleged history of, quote, PE, unquote, interpreted by the clinicians as pulmonary embolism, received an unnecessary CT scan to rule out a suspected recurrence of pulmonary embolus. As it happens, years earlier, the abbreviation, quote, PE, unquote, had been used in an electronic note to indicate the patient had had a physical examination, not a pulmonary embolism.
That's
It's a big
a
difference.
fairly major, significant interpretation of the note. So they were given a full workup to make sure they weren't having some sort of a
recurrence
issue.
Yes, and the problem gets worse because it's not like, okay, well, they made a mistake and they gave this patient an additional CT scan that was unnecessary, but that by doing so, it now stuck to his record, right? So in a example here, once a diagnosis of pulmonary embolism was mistakenly given, it lived on in the electronic health record, which becomes an issue, say, if that individual wants to go get a life insurance policy, and now they pull his health record, and his health record says that he's got a pulmonary embolism, which he never had, and
Right.
and now his premium is going to be double because of somebody's mistake. So this is not a mistake of the practitioner who wrote the note, and it's not really, like I could say, well, maybe it's a mistake on behalf of the practitioner who read the note. But the mistake is not an individual's mistake. It's a systemic mistake, which is people are using terminology and abbreviations and short strings and those types of things in ways that they understand when they are doing the documentation, but they haven't conveyed the meaning of what those things are to anybody who might actually use that. Now, in the past, it's funny. I was going through a box that had old documents in it, and I came across my health records from when I moved from the Boston area to the DC area in 1995. Well, they didn't have electronic health records then, so it was a stack of photocopied, notes, and it was kind of funny to read, the parts that I actually could read because it was in a doctor's, script, which half the time you can't read anyway. Or maybe that's just a joke. I don't know. I couldn't read most of it.
Well, no, I don't think that is a joke. I think that was a problem.
Yeah. And it was irrelevant because whoever reads that, I mean, like, who's going to read a bunch of photocopied documents? So anytime you go to the doctor, in 1995, even if you handed them a stack of printed records, they're going to say, well, I'm going to do all the tests that I'm going to do anyway and just do my own documentation. So it's one thing when you've got notes that nobody reads, but now anybody can read it because it's all electronic. And by virtue of the fact that all the notes are tagged or tacked onto the electronic health record, it makes them available for somebody to read. And on the one hand, the example that we were talking about just before, which was clinical trials, this is great because now I've got an electronic history of, say 5 years worth of a cancer patient's notes, and somebody can read through that and be able to make some kind of determination of whether that's good or bad. And if a person can do it, then everybody assumes, well, we can train an artificial intelligence system to similarly do it, and that would be great, unless your artificial intelligence system is interpreting PE as pulmonary embolism and not, physical examination.
Yes, and I know I just had a colonoscopy actually, and was provided through a portal the notes from the doctor who performed that is, in my record for my general practitioner to look at as well. And truth be told, these aren't handwritten. They're just typed out, but they're still hard to understand. It's like something was written about, and it was, as I read it as a layman, I was like, I don't think I really understand it. And again, it's all in natural language, but this doctor had his own kind of note-taking ability there. And the question is even though it's in character form at this point, is an AI going to be able to is anything going to be able to interpret that in a credible, consistent way without some other person kind of stamping their approval on it? I mean, how do you let these systems kind of go off on their own interpretation journey? How do you do that?
Well, you don't. I mean, you're hitting the nail on the head, which is these systems are not infallible, and they are going to be good at maybe doing a first cut, which would be saying, I now have a pool of 1,000 patients. I'm going to now, configure my AI system to say, here's the criteria I'm looking for candidates for some kind of clinical trial. Read through these 1,000 records and give me 300 that are good candidates. But somebody's still going to have to read through that, because you're not going to rely on an AI system that has 70% reliability to be making choices for you about whether an individual is going to be a good candidate for a trial. Or similarly, we have these other situations where it really boils down to this whole question of data sharing, and an environment where data that is being created by one set of entities is being used by other sets of entities for purposes for which it wasn't necessarily originally created. And to be able to properly use that data, there needs to be a consistency in the interpretation of what that data means. And that's this whole concept of semantic interoperability, which is let me see if I can find a definition. I'm sure it's the ability of systems to exchange data by way of mapping different terms to shared meanings. I'm just reading that from one of our other articles here.
Yeah, no, the example I saw when I was doing my research was around, kind of the challenges of semantic interoperability in a medical setting, was the word discharge, which I just thought was so funny, because in one interpretation, it means you're being released from the medical system, you're being discharged. But in another interpretation, it's not that at
that's
all.
Not what
it's
it
not
is.
Very pleasant.
Right. Right. Exactly.
And I'm sorry, I just couldn't resist. And so I wonder, as we kind of mature as a society and recognize these natural drawbacks of intersystem interpretation, why we can't get to some sort of universal medical terminology that potentially is enforced by force through some sort of an artificial intelligence. Whereas if you're not using the terminology, you're prompted to be compliant, or your notes are not going to be allowed into the system.
So let's put a pin on that. A pin
Okay.
in that. We're going to talk about that. But
I don't mean to get ahead of us.
No, but I want to look at some other examples. So we've mentioned smart cities in the past, and smart cities. When you say that term, people who are familiar with that concept immediately go to the concept of all sorts of sensors. Internet of Things. Parking meter sensors and street sensors and sensors all over the place. But smart cities doesn't necessarily only refer to data that's being streamed from machines. It is a combination of the ability to make use of data that's being produced by different organizations or different agencies within a municipality or within some kind of government jurisdiction. And a very simple example is differentiating. Well, I shouldn't use that word. A simple example is planning. And if I want to plan for how I'm going to do waste pickup, so garbage collection is a municipal service, and traffic is a municipal service. Traffic management or roadway management within city limits. So the people who are doing traffic management should probably be talking to the sanitation people, or maybe the other way around, just to make sure that, if the traffic people have decided that they're going to repave a neighborhood, they probably shouldn't do it on the day that they're doing garbage collection, because that's going to mess up one or the other of those two things. Another example is tax records and permit. So, Doug, you suddenly came into a windfall, and you decided you're going to build another, a 900 square foot addition to your house, and you need to go to the permitting services to be able to get an okay for you to, do the electric and to, enclose the location, et cetera. You've got to get their okay for all that, and that's part of what a municipality does. But the municipality also is collecting taxes on your property, and your property is the amount of taxes that they're collecting is based on the square footage of your enclosed space. So the people who are doing permitting should probably have data that is being read by the tax people, so that they know that you just double the size of your house or triple the size of your house. Maybe they should be tripling the amount of the taxes that they're collecting.
So let's keep going down this path. What other examples do we have?
So here's another example is something I was looking at the other day with one of our potential clients was consumer packaged goods, CPG, and retail, and optimizing analytics for that industry. Now they had bundled those two industries together, but they're actually two different industries. Retail is Walmart and Target and Dollar General. Those are the stores that are selling things that they're putting stuff on shelves, and then they are waiting for customers to pick them up and hopefully pay for them. And CPG, those are the companies that are making the stuff that goes on the shelves, and they're selling it to the store. So, it's funny, we don't think about stuff this way, but, when you look at these big companies like, Campbell's Soup, or I don't know whether that's the company, or Procter & Gamble or Coca-Cola, they make a bunch of stuff and they sell it, and they market it to you, the consumer, as if they're selling it to you. But they're not really selling it to you. They are selling it. They're selling it to the retail outlets, the vendors who are stocking that, on their shelves. So there's, your supermarket has limited shelf space. And so if you're like a Procter & Gamble, what you would like to do is not just arrange with that retail organization to sell your product. They want you to take up as much, they want the vendor to take up as much space on their shelves to nose out the competitors' products that are probably functionally identical. So there's dishwashing detergent, and lots of companies make dishwashing detergent. So as far as I'm concerned, does one make a difference whether I use one or another one? I'll buy the one that's on sale. But if I want to buy the one that's on sale, and it's not on sale because I go to the supermarket and they don't sell it, then I'm going to default to buying, if I have to clean my dishes, I'm going to buy some dishwashing detergent. And that's where we have this opportunity for doing analytics, which is the CPG companies, consumer packaged goods. They want to know how well their products are selling and where the options are for increasing their market share, which means they've got to get data from the different retailers. And Walmart doesn't share its data with Target, but Walmart might share its data with Procter & Gamble, and Target might share its data with Procter & Gamble, as long as Target knows that Walmart won't be seeing Target's data, and Target knows that Walmart won't be seeing, did I say that the right way? Whichever way. We don't want them to see each other's, right? Now, the other way around is if I'm Walmart and I go to Coca-Cola and I go to Pepsi, and I find that, my Coke products are flying off the shelf and Pepsi's gathering dust, then I'm going to want to allocate more shelf space to Coke products because we're going to be selling greater volume. And so the retailers want to talk to all the different CPG companies, but Coca-Cola might share data with Walmart, but as long as Pepsi doesn't get to see it. So we have this situation where there's a big demand for sharing data in ways that from across a network of different organizations. Now, we'll leave the governance and the data protection question to another day. But even if you're Walmart, you're getting data from Royal Crown and Barks and Coca-Cola and Pepsi, and I don't know who else makes soda, but whatever all the beverage companies are, you're going to be getting data about these beverages, and the data that comes from Coca-Cola doesn't necessarily look like the data that comes from Pepsi-Cola. And so we've got the same issue, which is how do I get some kind of mechanism that can, I guess, harmonize the information that is embedded in that data, even when I'm getting data from different structures and different organizations with potentially different interpretations.
I think where we tend to end up, at least in the way I see it, is where you get into this natural language, because ultimately numbers, at least retail numbers, strike me as being relatively easy to kind of normalize. But it's where you get this kind of one-off assessment of, and maybe it's a marketing analysis by Pepsi versus Coke, or maybe it's a advertising strategy that they're both entering into that then Walmart is trying to interpret as, which one is driving sales versus the other. And they're very different strategies because they are in this kind of more nebulous form of communication that may be hard to measure against one another. But I think it comes back to this idea of trying to get some sort of universally agreed to set of terms or measures or even codes that people can use as a way to connect the two sets of data into some singular form. So maybe why don't we take a break, and when we get back, we'll kind of talk about where we go and recommendations that you've made and have for how to work our way through this particular topic.
Want more Insight Jam? Follow us on Instagram for exclusive content like a daily dose of best practices and buying advice from industry experts and leading solution providers. Or subscribe to our YouTube channel for long-form highlights from our expert panel discussions. And if you prefer to listen, please rate and review the Insight Jam podcast on Apple, Spotify, or Google. The Solutions Review team is hard at work collecting the best enterprise technology information from around the globe, so don't miss out. Now, let's get back to the show.
All right, David, let's get into evolving standards and ontologies and try to sort out some ideas, some recommendations, some strategies for creating a path through semantic interoperability.
So semantic interoperability literally is about, let's look at those two words. Semantic is referring to meaning, and interoperability means I've got different systems that can operate together or operate in harmony. And what we are what I'm going to start with is just a description of something very simple, which is screws. Now, you know what a screw is, right? It's a thing that's got like a spiral, channel, and it's got something that you can use a tool to turn it around.
I've spent many hours in the Home Depot hardware aisle fiddling with screws because it's complicated.
Right. And the reason that you spend hours there is that there's, I don't know, hundreds of different types of screws that are characterized by, like, I think there's like 30 different characteristics. Right.
Threads
like,
per centimeter or something. I don't even know what the
some screws are right-handed, some screws are left-handed.
You sit there and you bring the one that you're trying to replicate, and then you try to screw all the ones into different nuts to try to get.
So I've got a screwdriver set. I don't have it here. I'm looking around to see if I have one here. There's like 15 different heads, right? There's both head. Sizes. There's like, the hex head. There's all these different types of screws. So there's and then some screws have flat heads, some have rounded heads, some have the regular cross pattern, some have the Phillips head. There's the pitch at which the threads go. There's the distance between threads. I mean, if you wanted to make a career as a screw expert, there certainly is an opportunity. But the thing about screws is that their characteristics are describable, and they are discernible in different domains. So I can talk about the head shape of a screw, and there's a flat head and a rounded head, but those are both types of the head. Those are the head types. And I've got the thread distance. That's a characteristics. And so I can actually build up what we call a taxonomy or a hierarchy that describes all different types of screws. So I can have at the top of this taxonomy this just concept of screw, and then I can say, well, there's 6 different types.
This is clearly established if you spent any time in the hardware aisle at Home Depot.
Exactly.
There is a taxonomy.
Right, there is a taxonomy.
There has to be. You can go from there to Lowe's to
exactly
Ace Hardware. Everybody's got the same screws.
However,
in the same naming convention.
Yes, but not everybody describes them the same way. And that's where we start seeing this whole issue, which is if somebody describes a Phillips head screw with PHLP and somebody else spells it out Phillips with 1 L and somebody spells it Phillips with 2 L's, they're still referring to the same thing. So from a semantic interoperability concept, those things all mean the same, whether I'm representing them using different terminology. And that's where we want to go, which is the concept of this knowledge management is can we infuse the structure of the way that we're using to describe things with the right hierarchical and relational structure that allows somebody who is looking at it to be able to develop the proper interpretation.
So who was in charge of who was the screw czar of the early 1900s that decided? I mean, how did they do it? How does it happen?
I don't know how. There certainly is opportunities for
titans
agreement.
of industry at the time decided, look, man, we can't.
Somewhere I've got a window where I've got an article from the United Nations. There's a organization as part of the United Nations that's looking at standardizing terminology for the purposes of commerce, semantic interoperability.
So how does it come about? I mean, how should we be thinking about it? I mean, how do you identify where there isn't standards, and how do you then drive standards?
So this is where I think what you were alluding to earlier is where we can start making use of AI systems to help us, which is, if I've got 100, let's say 1 million patient records that have been sanitized, but I've got all the notes associated with it, and I can go through, have an AI system scan through all of those notes and develop first identify what the terminology is that recurs across these different notes, and then be able to start looking at the context in which those terms are being used and be able to say, well, sometimes PE means pulmonary embolism, sometimes PE means physical examination.
Yeah, I think it has to be more prescriptive than that, to use a medical term. PE will never mean physical examination. You can't. You have to at some point say, you have to enforce, like, PE stands for this.
You're looking at a prescriptive, driver, right? You're looking at trying to.
Well, I think that's what the screw industry got to, was basically said, we're not going to keep accepting these screw types.
But if you look at the side of the box, there's like, you could look at a box from, one screw company, another screw company, and they will have the same terminology, conceptually, but they're going to spell. You want me to run over? I'm in the basement. I can run over and get a box of nails.
Well, nails are another.
Yeah,
but
and they're both fasteners.
Yeah,
as are paper clips. But the point is that
I think at some point somebody has to throw down and say, this is inbounds and this is out of bounds, and
for the future,
there's no.
As a future, I completely agree that in the future we would want to have guardrails around the process by which information is being
particularly around medical information.
Yeah, but that's not going to help the millions and millions of records that already exist. I mean, nobody's going to go in and transform those back into the sanitized version.
Which is why they'll make you redo it all over again.
Yeah, that's not
Every
going to
time you
happen.
go in for your physical, they make you fill it all out again.
Maybe, but more to the point, I think that the opportunity for semantic interoperability is to be able to evolve essentially it's the guidebook for how to make use of shared information. So when we go look at our CPG and retail environments, really what we're saying is how do we have an underlying knowledge environment that can help interpret what the different terms that are being used by Target versus the terms that are used by Walmart, so that when Coca-Cola looks at data that comes from Target and Walmart, they can put it together into their own environment and be able to make use of that. And I think that this becomes even more opportune when we look at how the spread of APIs, because the whole idea about APIs is you're exposing access to some aspect of your organization's data to other people to make use of it. And you have to carry along some kind of semantic guidebook to make sure that the data is being used is not being misinterpreted in the wrong way.
I'm of the mind, and I'm of the mind across a variety of lateral ideas here around us being a holder of our own data sets and responsible for our own data sets, and ultimately that we're the ones, who are the final arbiters of what our data says, and B, that potentially we are ultimately singularly rewarded for sharing our data as a valuable piece of information for organizations that are trying to extract some value out of that. So the current paradigm is that, in the medical community, we don't necessarily get to see all of the notes. I think we have access to them, or in theory we do, but how do you ever get to see all the notes in your data, in your medical data records? I don't know. Maybe you can request it. I suppose you can. But there's all kinds of things going in there that you never even would know to ask for, because they're just being input willy-nilly by the people that you're in. And again, if you have a more complicated medical condition, it's going in a massive amount of volume that you will never be able to properly comprehend. But similarly, every day we're sharing our data in any number of forms, in any number of subscriptions, and any number of online engagements that has real value to the people extracting it. I mean, it's a lead, it's a chunk of monetizable information that I represent if I'm looking for a new insurance policy or a mortgage or some other thing that I never receive monetary value for. So, I mean, where I'm at and where I think we need to go, and by the way, this goes into the fact that data is no longer secure, that my AT&T, 85 million AT&T records just got sucked out, and everything within them got sucked out, including I think it was all text messages. I mean, it was one of the most massive breaches in the history of breaches, which is not saying much these days, but AT&T, I don't know what penalty they'll pay, but it'll be peanuts compared to the value of that data that got sucked away into some God knows where. And quite frankly, I mean, there should be massive liability for that, or massive compensation direct back to the consumer for you losing all my data. That there should be genuine. We should take this on as a future episode. There should be general individual liability and compensation agreements in place for when you lose my data. My data has been hacked dozens of times across I don't know how many e-commerce systems and other holders of my data, and I've never received a penny for that. And God knows where it is now, but it's my data that I gave to you with the understanding that you would safeguard it, and you didn't. I mean, where do we go with this? I mean,
I don't disagree that this is a topic that we should tackle, and not to diminish.
I know I'm getting spun up here at the end. But...
Yeah, not to diminish your indignance over this happening.
I'm indignant.
But I want to pivot back to the opportunity here, which is we can make use of a taxonomy, which is that hierarchy that describes the way that different characteristics of data are related to each other, then ontologies, which show the context in which those objects relate. So I can say that a Phillips head screwdriver screws in Phillips head screws. That is a statement about the relationship between different objects, a tool and a fastener, and then I can develop a knowledge graph that has a full semantic embedding of the use of those terms within a particular system, so that if I were Walmart, I could then provide the knowledge graph to Coca-Cola that says, here's how we are making use of sales data or inventory data that allows you to integrate that into your analytical environment and be able to improve the way that you provide us with a mix of soda. Not that the data privacy issue isn't an issue, but I think what I'm hoping to get at is that in the healthcare business, in the supply chain, in retail, and CPG, in what was the other example that we gave? Maybe I didn't give it another example, but in all manufacturing, in all those cases, whoever is making use of this shared data is going to benefit. If I give you data, that's one thing. If I give you data and tell you how to use it, that's much better. And so we can make use of these approaches of developing knowledge graphs and knowledge management tools, and using that to augment a data catalog that describes all the different data elements that are available and how they're to be used. When it comes to smart cities was the other example that we used. If the different agencies within a government jurisdiction are able to make use of the data that's being made available through open data sets, that's a benefit to the citizenry.
Yeah, I mean, it strikes me that these things are driven ultimately by the benefit of the parties. And so, there's obviously a benefit to have semantics around screw size, because if you're selling screws, you have to at some point put a limit on how many screws you're willing to try to sell. And so you say these are the sizes and this is it. You want to make screws, that's fine. You can come into the market and make screws, but you can't make new screws.
But it's important to say a pipe fitting company to have good understanding of the description of what their products are, because that data is just being taken by all the e-commerce companies like Amazon, and they're just posting it directly to the page for the products, which then improves findability. If I know that here's the right terminology around whether this pipe fitting is going to fit my pipes, then I'll sell more pipes fittings.
Yeah, I mean, these things I think are fairly easy to sort out when it's Walmart. I mean, when the interested parties have a financial benefit at play. I think it gets far more ambiguous when it's the citizenry and the government tracking your license plate throughout a city and taking pictures of your behavior around a city, where you're beginning to feel a little less comfortable with your data being captured without your implicit consent. And secondarily, or explicit, I should say, explicit consent. And similarly with your medical information, where, there is no role necessarily for the patient in the determination of whether PE is pulmonary embolism or physical examination, because you're not even a part of that process of writing or interpreting the writing, because it's happening outside of, even though you're a party to the process, you're disintermediated from the standard establishment. And so what's the incentive? I get the incentive for Walmart and Pepsi and Coke, and I get the incentive for Home Depot and the screw manufacturers, and I get the incentive of the government to want to track the citizenry. But I'm not sure the citizenry understands the value equation there, nor do I think that the patient citizenry understands where they fit into the normalization patient data, other than the fact that, they don't operate on your left shoulder versus your right shoulder, or whatever the outcomes could be that would be bad for you because it thought it was your father. But
well, if you were raising these questions,
these are the questions
an hour
I think.
ago,
It's like,
we'd be able to talk about it. But I think we're going to have to reserve
yeah, this is good stuff. I mean, data always brings out my indignance in the final analysis, because it does come down to, because ultimately it comes down to the fact that it can be used nefariously, or more to the point, it is employed in a cavalier and sometimes negative way, and that by the same token, a lot of data is monetized in an incredibly valuable way for parties that don't necessarily share the value of that data that they happily gobble up, and don't have, again, coming back to breaches and where all this data ends up, they don't have any kind of regard for the safeguarding and their stewardship.
Well, I guess what you're suggesting is that we have a special edition episode on the private data ownership.
I'd like to have a longer conversation about where we're headed with the amount of breaches that are happening. I mean, we can sit here and we can chronicle them, at least the most recent ones, and understand the implications and also the repercussions to the reckless entities. Because I tell you what, man, that frosts me no end.
All right, well, I know how to get your goat now. Start talking about breaches. So
okay, well, it's not even just breaches. It's the responsibility, the liability, all that. Anyway, David, always a pleasure. Again, one of our solutions review experts, and all that we're doing here with David at Solutions Review and in the Insight Jam, and certainly with David doing all of his things outside of all those areas at Knowledge Integrity. David, please share with us how folks can get a hold of you if they want to have a conversation.
Best way, reach out to me through LinkedIn. You should be able to find me by just typing my name in. You might find some of those other David Loshins I was referring to, but I'm the one that's got the data stuff. So that's one way, or I think you can, if you again look in the notes, there's my email addresses in there. You can reach out to me directly, and I'm looking forward to hearing from people and hearing about their experiences.
Yeah, and then when you're not talking to David, he's out there driving standards worldwide, all over the place, including Australia. So,
yep.
Yeah, neat stuff. David, thanks again for the time. Always a pleasure chatting. Look forward to doing this again in a couple weeks.
Yeah, thanks so much.